Welcome. My name is Peter Strong and I provide mindfulness therapy over Skype. I have been teaching mindfulness therapy for 12 years now, and I find it to be extremely effective for working with anxiety and also depression and addictions and many of the common psychological and emotional problems that we experience in life. The mindfulness approach is extremely good at working with the mind, with emotions and with thoughts and with traumatic memories also. We learn how to develop a mindful, conscious relationship with our mind. That means we learn how to meditate on the mind. Most people are not used to this approach. They try to either get away from the mind, they may even use meditation to escape the mind. But this is, in my opinion, the wrong approach. We should be learning how to change the relationship that we have with the mind. If you avoid painful emotions or painful thoughts or painful memories, then that will basically feed that emotional pain, and it will not heal. So avoidance is not a good strategy. And really, any form of reactivity that takes consciousness away from the mind is going to simply leave those emotional reactive habits intact. It will not promote healing. So mindfulness is about developing more consciousness of the mind, not less. And we do this by meditating on our thoughts, on our emotions, on our memories, on anything that is in a state of suffering that's not resolved properly. So we hold our emotions in the mind. We learn how to build a relationship that is non-reactive and fully present with the emotions or thoughts or memories. This is what promotes change and healing, the quality of that non-reactive relationship. Reactivity, whether it's avoidance or aversion, or whether it's even just talking about the emotion or labeling it or judging it in some way, any form of reactivity like that will simply feed the underlying habit and will stop it changing. But when you do the opposite, that is, cultivate a conscious, mindful relationship with the emotion or other mental object, then that allows healing to take place. It's rather like being by a fire. The nature of the fire is to burn itself out. That's its natural path. But we inadvertently feed the fire by throwing fuel on it. Well, reactivity is like that fuel. It feeds the fire of anxiety or depression or any other form of emotional suffering. So the first step in mindfulness training is learning how to overcome that habit of reactivity to our emotional pain, whether that's anxiety or depression. The second part of mindfulness training is to investigate the structure of your emotions. So this means looking at the imagery of the emotion. What color is it? How large is it? Is it large or small? What is the position of the emotion? How do you see it in the mind? Do you see it above you? As in, does it feel overwhelming? Does it weigh heavily on you? People often experience painful emotions rather like a weight, something heavy weighing down on them. What color is it? Very important. Most people, when they look at an emotion like anger, they will see the color red. Depression has the color black, and so on. These colors are all part of the imagery. Now, that imagery is what actually creates the emotion. It's what holds it together. So investigating the imagery of our emotions is very important, and when we change that imagery, we help the emotion heal. So there's a direct relationship between the emotion and the emotional imagery, and when you change one, you change the other. So that is described as the response of compassion, which is a strong part of mindfulness therapy. It's not sufficient to just see the emotion and not react to it. We must respond by helping it heal, and we do that by changing its imagery. So mindfulness therapy is an interesting, exciting, and really quite novel approach for most people. People really enjoy working with their mind in this way, actually getting to see how their mind works, and then developing those skills that promote healing and well-being. Because it's so focused, mindfulness therapy is usually very, very quick at producing substantial changes and improvements. Most people see quite remarkable improvements after just 3 or 4 Skype therapy sessions with me. The secret is learning how to apply mindfulness to investigate your emotions and then to promote healing. And when you develop these skills, you can practice them between sessions, so that greatly increases the rate of recovery and healing. One person I was working with just recently was suffering from PTSD and was plagued by very upsetting visual images, memory images that were quite traumatic, and these images would keep appearing and re-traumatizing her. So how do we work with that? Using mindfulness. Well, we learn to meditate on those traumatic images. First of all, learning to stay conscious and present with those images without reacting, which feeds them. Then we explore the response of compassion. How can we help that image change? And in her case, she found that if she was able to shrink the image down, to make it very, very small, and then she was able to take that traumatic image and hold it in her hands and comfort it. And this really changed things around in a big way for her. And after no more than 2 or 3 sessions of and the homework of practicing being with her traumatic memories using mindfulness in this way, meditating on those traumatic memories, she basically became free from the re-traumatizing effect of that memory. She could recall the event and not feel the emotional trauma. So that's one example of the power of working with the images of our emotions. The same approach can be taken with any emotion, whether it's anxiety or depression or anger or compulsion in the case of an addiction. All emotions are structured around imagery, And when you get to see what that imagery is, you can change it. And changing the imagery is a central, necessary step for healing. So if you'd like to learn more about mindfulness therapy over Skype, and you'd like to schedule a session with me to see how effective this is for your particular needs, then please email me. Simply reach out to me by email, tell me more about yourself and how I can help you, and when you feel ready, we can schedule a Skype therapy session. Thank you.